Hello everyone, and welcome to our health channel. If this is your first time watching our program, please remember to hit the subscribe button and ring the notification bell so you won't miss the health information we carefully prepare for you each week. Today, I want to share with you an extremely important topic that directly concerns life safety. With summer approaching, we're entering the peak season for snake activity, and this knowledge could save your life in a critical moment. This past June 2nd, a heartbreaking news story shocked the entire Chinese-speaking world. A female tourist visiting Sanya, Hainan Province, China, encountered what would become her final tragedy on what seemed like an ordinary night. This tourist, surnamed Fu, was walking back to her hotel around midnight on June 2nd, when she was bitten by an unidentified creature, and began bleeding immediately. At the time, she probably thought she'd been bitten by a common insect or small animal. After returning to her hotel, she simply disinfected and treated the wound, not thinking much of it. However, fate took a dramatic turn within that single hour. By 1 a.m., she began experiencing nausea and vomiting, and more frightening still, her right leg began to go numb. Only then did she realize the severity of the situation, and rushed by taxi to Sanya Central Hospital's emergency room. Upon arriving at the hospital, she told doctors she was there due to unknown creature bite followed by nausea, vomiting, and right leg numbness for 1 hour. Hearing these symptoms, the doctor immediately recognized this was likely a venomous snake bite, and began emergency treatment right away. However, the condition progressed rapidly and severely, and the hospital immediately transferred her to a more experienced military hospital, hoping to save this young life. Despite the medical team's full efforts, this female tourist ultimately succumbed because the toxin spread too quickly, and they couldn't prevent the poison from damaging vital organs. She tragically passed away in the hospital. What began as a happy vacation became a family's eternal grief. What does this tragedy teach us? First, snake bites are never minor incidents. From bite to death can be just a matter of hours. Second, many people lack awareness of snake bite severity, thinking simple treatment will suffice. Third, the importance of emergency care knowledge. If this tourist or those around her had known proper first aid, the outcome might have been different. Friends, while America may not be as vast as China, our country has an impressive variety of snake species, including several that are extremely venomous. According to CDC statistics, approximately 7,000 to 8,000 Americans suffer snake bites annually, with about 5 resulting in death. While the fatality rate isn't high, improper treatment can still have very serious consequences. This is especially true for us seniors, whose bodies have naturally weaker resistance, making symptoms appear faster and more severely when bitten by venomous snakes. Summer is here, temperatures are rising, and this is precisely when snakes are most active. Snakes are cold-blooded animals, so the hotter the weather, the more active they become, increasing their feeding and activity frequency. Summer also means more outdoor activities for us. Hiking, camping, backyard barbecues, or even just walking around our neighborhoods, all present opportunities to encounter snakes. America's venomous snakes deserve serious respect. We have the big 4 venomous snakes that cause most serious bites. First is the eastern Diamondback Rattlesnake, found throughout the southeastern United States, from North Carolina down to Florida and west to Louisiana. These are the largest venomous snakes in North America, and their bite can be fatal if untreated. Their venom is primarily hemotoxic, causing severe pain, swelling, and tissue damage. Then we have the timber rattlesnake, distributed across much of the eastern United States, from southern Maine to northern Florida, and as far west as Minnesota and Texas. These snakes prefer wooded areas and are often encountered by hikers and campers. Their venom causes similar effects to the eastern diamondback, but is generally less potent. The copperhead is probably our most commonly encountered venomous snake, found throughout the eastern and central United States. While their bite is rarely fatal, it can cause significant pain, swelling, and tissue damage. Many seniors encounter these snakes in their own backyards, especially in areas with rock walls, wood piles, or dense vegetation. The cottonmouth, also known as the water moccasin, inhabits wetlands, swamps, and slow-moving waters throughout the southeastern United States. These semi-aquatic snakes are often encountered by fishermen, hunters, and those enjoying water activities. Their bite can be quite serious, causing both local tissue damage and systemic effects. We also have the highly dangerous coral snake in the southern states, whose neurotoxic venom can cause respiratory paralysis. And let's not forget the various rattlesnake species throughout the western states, including the western diamondback and prairie rattlesnake, each with their own regional distributions and venom characteristics. Why do we seniors need to be especially careful? First, as we age, our immune systems gradually weaken, reducing our resistance to toxins. Second, our metabolism slows down, meaning toxins remain in our bodies longer, causing greater damage. Third, many seniors have chronic conditions like diabetes, high blood pressure, or heart disease, which can affect the body's ability to process toxins. More importantly, we seniors may not react as quickly as younger people in emergency situations. In snakebite scenarios where every second counts, this could mean missing the optimal treatment window. Please remember to like our video and share it with friends who need this information. Your support motivates us to continue producing quality health content. So what should you do if you're unfortunately bitten by a snake? First and most importantly, stay calm. I know this is difficult, but panic and vigorous movement will accelerate blood circulation, causing toxins to spread throughout your body more quickly. Step 1. Immediately leave the bite location to avoid further attacks. However, move slowly, don't run or engage in vigorous activity. If possible, remember the snake's appearance characteristics, as this is crucial for subsequent treatment, but never risk trying to catch the snake or take photos. Step 2. Immediately call 911 for emergency services. Don't think about driving yourself or having family take you to the hospital. Ambulances have professional emergency equipment and personnel who can begin treatment during transport. When calling, clearly tell the operator it's a snake bite and that antivenom may be needed. Step 3. While waiting for the ambulance, properly treat the wound. Rinse the wound with clean water and remove any jewelry, watches, or tight clothing, as swelling may occur. If a hand or foot was bitten, immobilize the injured limb and keep it below heart level to slow toxin flow toward the heart. Step 4. If you have an elastic bandage, you can wrap it about 2 to 4 inches above the bite site, but don't make it too tight. It should be loose enough for a finger to slip underneath. This action slows venous return but shouldn't cut off arterial blood flow. Now let's discuss what you absolutely must not do. First, don't cut the wound open. Many people think draining the poison blood will help, but this is completely wrong. Cutting the wound won't remove toxins and will actually increase infection risk, while potentially damaging nerves and blood vessels. Second, don't try to suck out the venom with your mouth. This is a common movie scene, but in reality, it's extremely dangerous. Mouth bacteria can cause wound infections, and if the person sucking has any cuts in their mouth, venom could enter their bloodstream. Third, don't apply ice. Many people think ice can slow toxin spread, but actually, ice causes blood vessels to constrict, increasing local toxin concentration and potentially causing more severe tissue death. Fourth, don't drink alcohol or take pain medications. Alcohol affects liver detoxification and dilates blood vessels, accelerating toxin spread. Pain medications can mask symptoms, preventing doctors from accurately assessing the condition. Fifth, don't believe in folk remedies or herbal treatments. The internet is full of supposed snakebite remedies, but these lack scientific basis and can delay proper treatment. Remember, antivenom is currently the only effective antidote. What symptoms appear after a snake bite? This depends on the snake species and venom type. The Sanya nausea, vomiting, and limb numbness were all typical snakebite symptoms. If bitten by a snake with hemotoxic venom, like most rattlesnakes, the most obvious symptom is severe wound pain with rapid swelling, and the color may turn purple-black. Blood in urine or stool may follow, as the toxin destroys platelets and clotting function. If bitten by a snake with neurotoxic venom, like the coral snake, the wound initially might not be very painful, but neurological symptoms appear quickly. Patients feel weakness, difficulty speaking, difficulty swallowing, and most seriously, respiratory muscle paralysis leading to respiratory failure. Mixed venoms create more complex symptoms, with both hemotoxic and neurotoxic effects appearing rapidly and severely. This explains why the Sanya tourist died within just a few hours despite medical treatment. After reaching the hospital, how do doctors proceed? First, they assess the wound condition and patient's vital signs, including blood pressure, heart rate, breathing, and temperature. Then blood tests check if clotting function and liver/kidney function are affected. The most important treatment is antivenin injection. The United States maintains supplies of antivenin for North American venomous snakes, which is currently the only effective antidote. However, antivenin isn't perfect. It must be used early in envenomation to be effective, and some people are allergic to it, requiring skin testing first. Besides antivenin, doctors provide supportive care. If breathing difficulties occur, intubation and mechanical ventilation may be necessary. If blood pressure drops, for fluids and pressure medications are needed. If clotting abnormalities develop, blood transfusions or platelets may be required. Wound care is also crucial. Doctors clean the wound, administer tetanus vaccination, and prevent infection. If tissue death is severe, surgical debridement may be necessary, and in extreme cases, amputation. American medical standards are very high, and major hospitals have experience treating snake bites. Medical centers like Mayo Clinic, Johns Hopkins, Cleveland Clinic, and others have toxicology or emergency medicine specialists, with adequate antivenin supplies. However, the most important factor remains early medical attention. Don't delay treatment. How can we prevent snake bites in daily life? First, choose appropriate clothing. When visiting wilderness areas or doing outdoor work, always wear long pants, long sleeves, and protective footwear, preferably boots or high-top shoes. Snake strikes usually don't exceed knee height, so protecting the lower body is most important. Second, choose your timing carefully. Snakes are typically most active during dawn and dusk hours, so extra caution is needed during these times. If you must be outdoors during these hours, always carry a flashlight to illuminate your path ahead. Third, pay attention to your environment. Snakes like to hide in tall grass, rock crevices, wood piles, under porches, and near water sources. When walking, pay special attention to these areas and don't carelessly move through brush or reach into unseen spaces. Before sitting outdoors, first check the surrounding area for snakes. Fourth, make noise as you move. Snakes are very sensitive to vibrations, so walk with deliberate steps to alert snakes to your presence so they can move away. However, if you've already spotted a snake, move away slowly without sudden movements or loud noises. Fifth, use the buddy system. Especially for us seniors, it's best not to venture into wilderness areas alone. Having a companion means immediate help and assistance if an accident occurs. What should you do if you encounter a snake during outdoor activities? First, stay calm and don't panic. Most snakes won't actively attack humans. They typically only bite when frightened or threatened. If the snake is still far away, slowly back away and maintain a safe distance. If the snake is right at your feet, don't move suddenly, slowly lift your foot and step backward. Never try to chase away or attack a snake, as this will only anger it. If you're actually bitten by a snake, remember the emergency steps I mentioned. Stay calm, immediately leave the area, call 911, properly treat the wound and wait for rescue. Time is life and every minute is precious. Although America is large, snake distribution is extensive. From urban parks to remote wilderness areas, snake encounters are possible everywhere. Climate change has particularly affected snake distribution patterns, and snakes may now appear in areas where they weren't previously found. I recall news reports from recent years about hikers being bitten by rattlesnakes in national parks, and homeowners discovering copperheads in their gardens. This shows that snakes aren't far from our daily lives, and we must always maintain awareness. Besides being careful during outdoor activities, home environment attention is crucial. Keep your yard clean, regularly clear weeds and debris piles, and eliminate snake hiding places. If you discover a snake at home, don't handle it yourself. Call 911 or your local animal control for professional assistance. Speaking of this, I want to especially caution friends with chronic conditions. If you have diabetes, pay special attention to wound care, as diabetes affects wound healing and increases infection risk. If you have heart disease, emergency situations may trigger cardiac problems due to stress, so always carry your heart medications. If you're taking blood thinners like warfarin, aspirin, or other anticoagulants, bleeding risk after snake bites is higher, so immediately inform medical personnel about any medications you're taking. Family members with senior relatives should also pay special attention to their outdoor activity safety. You can prepare a simple first aid kit including basic supplies like elastic bandages, antiseptic, flashlight, and whistle. More importantly, teach them basic first aid knowledge so they know how to respond in emergencies. Cell phones are now ubiquitous, so seniors should always carry phones when going outdoors and ensure adequate battery life. Store emergency contact numbers including family, hospitals, and 911. If possible, inform family of your plans and expected return time before leaving, so they can discover problems and assist with rescue if needed. Another crucial concept is regularly updating first aid knowledge. Medical knowledge advances and first aid methods evolve. I recommend attending first aid courses offered by the American Red Cross or other organizations to learn the latest emergency techniques. We must also dispel some false myths. For instance, some believe venomous snake bites are always fatal. This isn't true. With modern medical technology, most snake bites can be successfully treated with timely medical attention. Others think non-venomous snake bites are harmless. This is also wrong. Even non-venomous bites can cause infections and require proper treatment. Additionally, the internet contains many rumors and folk remedies about snake bites. Never believe these. Things like bourbon therapy or herbal treatments not only lack scientific basis, but can delay proper treatment. Remember, antivenin is currently the only effective antidote. Other methods are merely supportive care. American health insurance systems vary widely, but most insurance plans, including Medicare, cover snakebite treatment costs, including antivenin. However, if bitten while traveling abroad, costs can be extremely high, so purchasing travel insurance before international trips is advisable to ensure medical coverage. The Sanya incident also reminds us to be especially careful when traveling abroad. Different regions have different snake species with varying toxicity levels, and local medical standards and antivenin supplies may not match American standards. Therefore, research local risks and prepare protective measures before traveling internationally. Finally, I want to share some successful treatment cases to show that with proper handling, snake bites can be cured. Last year, a 72-year-old grandfather was bitten by a rattlesnake while hiking in Arizona. His family immediately called 911. The ambulance quickly reached the scene, and emergency treatment began during transport. After reaching the hospital, antivenin was immediately administered, and after a week of treatment, he fully recovered and was discharged. Another case involved a 65-year-old grandmother bitten by a copperhead while gardening at home in North Carolina. She didn't panic, immediately washed the wound with clean water, then called 911. Due to proper handling and timely medical attention, She recovered after just 3 days of hospitalization. These success stories teach us that snake bites aren't terrifying. What's terrifying is ignorance and panic. With correct knowledge and calm responses, we can overcome danger. As summer approaches, snake activity will become increasingly frequent. Through today's sharing, I hope to increase everyone's awareness and prevention consciousness regarding snake bites. Remember these key points. Prevention beats treatment. Proper first aid can save lives, and timely medical attention is crucial. Each of us must take responsibility for our own safety. Especially we seniors with relatively weaker physical resistance need to be more cautious. However, don't let fear prevent you from outdoor activities. Appropriate outdoor exercise benefits health, and with proper protective measures, you can safely enjoy nature's beauty. Younger family members should also care about seniors' safety, teaching correct protective knowledge and accompanying outdoor activities. This both strengthens family bonds and ensures safety. Society also needs more safety education and outreach. Schools, communities, and media should all strengthen snake bite prevention knowledge dissemination, so more people understand proper handling methods. Government agencies should also install warning signs in high-risk areas to alert the public to safety concerns. Snakes are an important part of the ecosystem, and we should learn to coexist peacefully with them, rather than simply fearing or eliminating them. The correct attitude is respecting nature while protecting ourselves, enjoying outdoor activities while leaving living space for snakes. Most importantly, share today's learned knowledge with more people. Knowledge dissemination can save lives, and your sharing might be someone else's lifeline. Encourage friends and family to learn first aid knowledge together, and raise safety awareness together. Remember, life happens only once, and there are no small matters when it comes to safety. While we can't completely prevent accidents, through correct knowledge and preparation, we can maximally protect ourselves and our families. Snake bites are low-probability events, but when they occur, consequences can be very serious. Better to prevent beforehand than regret afterward. I hope everyone can safely enjoy outdoor activities and live each day healthily. Today's content ends here. I hope this knowledge helps everyone, and I hope you never need to use these first aid methods. But learning is better than not learning, and being prepared is always right. Thank you for watching today's program. If you found this information helpful, please be sure to hit the subscribe button and turn on notifications, and share this video with other friends and family who need it. Each time you share, you might save someone's life at a critical moment. Remember, safety knowledge is needed by everyone, and prevention awareness is essential. Let's work together for our own and our family's safety. See you next week.